all, I am Dr. Gunjan Gupta. I am Director with Gunjans Gynae and Neuro Clinic and Senior Consultant Gynecologist at Max Hospital Vaishali and Shanti Gopal Hospital, Indrapuram. My field of interest are infertility, laparoscopy, IVF and colposcopy. I have trained from King George Medical College, Lucknow and Maulana Azad Medical College, and then I further moved on to United Kingdom. I am a member of Royal College of Obstetricians and Gynecologists, London, and trained into laparoscopy from France. My other field of interest, which is very close to my heart, is about women health and their upliftment. So that is why I plan to speak today about cervical cancer screening and treatment. Now, why to talk about cervical cancer? Well, it is because it is the most common cancer of females in India. It surpasses the body breast cancer also in this country, whereas worldwide it comes at number 3. Believe me, 1 out of 7 females are diagnosed with the disease in this country. So why in our country are we having such a high incidence of cervical cancer? Well, that is because we don't have an organized screening system which runs worldwide. It is so sad that such a simple test as pap smear, which can diagnose the condition or the abnormalities of the cervix at a much earlier stage than cancer, where it is 100% curable, is not being done in our country. We can diagnose the abnormalities of the cervix by pap smear, and there is an advancement in the technique called liquid-based cytology, and further evaluations are done by colposcopy and HPV DNA testing. A common myth is that pap smears are painful. Well, they are not. Pap smear is a simple procedure including LBC and colposcopy, can be done at the outpatient basis in clinics, requires hardly 10 to 15 minutes, no bed rest is required, and you can resume your normal day-to-day activity after that. How is LBC done? This is done by means of a simple brush which we take, brushings which we take from the mouth of the uterus or the cervix and send it to the lab for testing. The report takes 3 to 5 days to come, and further evaluation is then done by colposcopy if abnormalities are diagnosed. During colposcopy, we can see and diagnose abnormalities of the cervix like ulcers on the mouth of the uterus, which is known as cervical erosions, or precancerous lesions of the cervix, which we call as cervical dysplasias. In the procedure, we take special images by means of a microscope or a special equipment called as colposcope, put certain filters and colors to it and certain medicines, and it gives us an exact mapping of the abnormality. And on the basis of abnormality, simple procedures can help us in treating the condition. At this stage, treatment is as simple as a simple freezing procedure known as cryo, or by means of excision, which we call as lead. So here I would just like to show you a simple thing. This is how the colposcopic report looks, in which there is a normal cervix and this has no abnormalities in it. Therefore, it is dark brown in color. Whereas this is the image of an abnormal cervix which does not take up any stain and it is yellow in color, and here we see it white. So these are simple tests which help us to diagnose the condition. Here at Gunjans Gynae and Neuro Clinic, we are doing this procedure as a routine. If you want to connect with me, you